Roxy and I'm Dr. Morwood, Surgery Coordinator. Rest and recovery after your surgery is a very important part of your care. Let's pay close attention as Dr. Morwood discusses his recommendation for rest, recovery, and activity level protocol after surgery.
I'm Dr. David Morwood. Thanks very much for paying close attention to this very important instructional video. As Roxy said, that post-operative period and recovery and rest and return to normal activity is a very important part of your care that I think it's really important prior to the operation you get clear and you look on your calendar and you pick out the right time for you to have your operation. First of all, after almost any operation that we do in plastic surgery, I recommend rest and take it easy at home for 3 days and 3 nights. I don't mean lay in bed because that's not healthy, you might get a blood clot, but rest and take it easy at home for 3 days and 3 nights. What do I mean about that specifically? That's your time to listen to music, to listen to books on tape, maybe catch up on email, maybe write letters if anybody writes letters anymore, make phone calls, but that's your time to rest, stay home, and take it easy for 3 days and 3 nights. It's very important to let the area of the operation, let the area of the surgery rest. It's very important not to get your blood pressure up, and I think it's very important for your recovery that you do rest and allow yourself some time to get your strength back. So that's 3 days and 3 nights of rest at home. On day 4, I encourage a little more activity, but don't get your blood pressure up high. What do I mean by that on day 4, a little bit more activity? Short walking is good, get some fresh air is good. If you happen to be a golfer, a little bit of putting is good, but don't swing hard and don't drive. If you want to do some stationary bike, easy. If you want to do some elliptical strider in an easy way, I think that's ideal. Walking is great, getting fresh air is great. But on that day 4, a little bit more activity, but just don't get your blood pressure up high. Up until day 11, I encourage you to slowly get back to your life. Now, what do I mean by slowly get back to your life? I don't want you to play basketball on day 11. I don't want you to go to the golfing range and hit a bucket of balls as hard as you can on day 11. I don't want you to do jogging or run a race on day 11, but slowly progress to your normal activity starting on day 11. So let's review this again. 3 days and 3 nights of rest and take it easy at home. Don't lay in bed, but just take it easy at home. On day 4, a little bit more activity, but don't get your blood pressure up high. Walking is good. Easy stationary bike is good. Take it easy on the elliptical strider, etc. And on day 4, we have plenty of people who may sit at a desk. They may go into the office. They may do some work at home, do some telephone work, do some paperwork. But don't do anything that'll get your blood pressure up high. Continue to rest and recover. And again, on day 11, slowly get back to your life. Certainly, as Roxy said, your rest and recovery period is a very important part of your care. If you have any questions whatsoever, please feel free to ask. We want you to be comfortable. We want you to be honest with yourself. Look at your calendar and let's choose together and decide when is the best time for your plastic surgery operation.
Thank you so much for paying attention to this important topic. Please ask if you have any questions. We're here to help you be fully prepared for your surgery, and we want you to have the best possible outcome.